A cancer diagnosis is a life-changing event. It brings physical changes but also deep emotional and psychological impacts. These hidden burdens can be as challenging as the physical symptoms of the disease. It's crucial to recognize that cancer affects not just the body, but also the mind and spirit of the individual. This essay explores the profound psychological experiences of cancer patients, advocating for compassionate and individualized care. Too often, the focus in cancer care remains on treating the physical disease. While this is undoubtedly critical, we must also address the emotional turmoil that patients experience. Fear, anxiety, sadness, and even anger are all normal reactions to a cancer diagnosis. These emotions are not signs of weakness, but rather human responses to a life-altering situation. It's essential to remember that each patient's journey is unique. Their emotional response is shaped by various factors like their personality, support system, cultural background, and the specific type and stage of cancer. What one person finds helpful, another may not. Healthcare professionals, loved ones, and society at large must approach this journey with empathy and understanding. Every individual experiences cancer differently. There's no one-size-fits-all response to such a diagnosis. Some patients may appear stoic and strong, while others might openly express their fears and anxieties. Neither response is right or wrong, they are simply reflections of individual coping mechanisms. It's important to avoid making assumptions about how someone should feel or cope. Instead of offering unsolicited advice or comparing their experience to others, focus on active listening. Let them share their feelings at their own pace and in their own way. Sometimes the most powerful thing you can do is simply be present and offer a safe space for them to express themselves without judgment. Remember, empathy is key. Trying to understand the situation from the patient's perspective can guide us in providing the support they truly need. This might involve connecting them with support groups, offering practical help with daily tasks, or simply being a compassionate listener. It's crucial to normalize the distress that cancer patients experience. Let them know that their feelings of fear, anxiety, sadness, and even anger are valid and understandable reactions to their situation. This validation can be incredibly comforting and help alleviate feelings of isolation. Empowerment through information is another vital aspect of supporting cancer patients. Provide them with clear and accurate information about their diagnosis, treatment options, and potential side effects. Knowledge can help reduce fear of the unknown and allow them to make informed decisions about their care. Encourage patients to actively participate in their treatment plan. This can involve discussing their preferences, exploring coping strategies like mindfulness or relaxation techniques, and connecting with support groups or mental health professionals. By taking an active role, patients can regain a sense of control during a time when so much feels uncertain. Compassionate communication is paramount in cancer care. This involves not only healthcare professionals but also family members, friends, and the wider community. Patients need to feel heard, understood, and supported throughout their journey. Family members and loved ones also require support. Caring for a loved one with cancer can be emotionally and physically draining. Encourage them to seek support groups or counseling services to address their needs and practice self-care. Ultimately, providing holistic and individualized care is essential to improving the quality of life for cancer patients and their loved ones. By addressing the emotional and psychological aspects of cancer alongside the physical, we can help patients navigate this challenging journey with greater resilience and hope.